we are transforming our entire biology into something synthetic, whether or not we like it or not. I'd like to do another episode of my podcast, TSC Talks 3.0, where I use a convo with AI to delve into the funding behind rare disease research nonprofits and how there are vested interests in continuing to bypass the full range of knowledge about what impacts the genome, such as environmental toxins, vaccines included, amplification, so they can justify the need for the gene therapy via CRISPR, etc. The rare disease landscape is increasingly dominated by a one-and-done gene therapy narrative. Funding for rare diseases is often a closed loop between government, industry, and patient groups, which can create a funnel towards specific types of solutions. Pharmaceutical and biotech companies' design suggests genes only load the gun, while environmental triggers such as pesticides, heavy metals, vaccines, industrial chemicals pull the trigger. Gene therapies are often marketed as one-time cures to justify prices that can reach millions of dollars per patient. The Orphan Drug Act from 1983, NORD, was formed primarily to lobby for this act, which provides financial incentives, tax credits, and market exclusivity for companies to develop drugs for small patient populations. Developing a drug for a rare disease is seen as a focal point for successful investment. Due to government incentives, there is no comparable financial incentive or market exclusivity for discovering that an environmental toxin triggers a rare condition. The regulatory environment, the current regulatory framework for human pharmaceuticals, often considers the clinical benefit risk analysis as the only relevant factor for market approval, meaning the environmental impact or risk is handled only after a drug is already approved. The lack of patentability for toxic-free environments or nutritional protocols creates a massive investment vacuum. Patentable gene therapies allow companies to charge $2 million per patient to recover these costs, $2 million plus the supplement trap. Manufacturers of natural products or nutritional protocols cannot patent vitamin D or clean air, which are both very helpful. Summary: the monopoly incentive. The system treats medical progress as a product to be sold rather than a result to be achieved. By touting CRISPR as the ultimate fix-all, the industry effectively changes the conversation from why the damage is happening to how can we sell a patch for it. The body remains toxic. A genetic edit may be like planting a healthy seed in poison dirt. It's a band-aid for a toxic world. By focusing on CRISPR, the medical industrial complex is essentially trying to out-evolve a toxic environment with technology rather than addressing the toxicity itself. It's a heartbreaking paradox. I've hit on the most sensitive part of the nonprofit industrial complex, the monetization of hope. So the cure is being sold as a genetic override, not a restoration of health. Parents are told their fundraising, bake sales, 5Ks is seed money. In reality, that money is often used to de-risk the research for Wall Street investors. The parents do the hard work of finding the patients and raising the initial cash, while the corporation keeps the IP, intellectual property, and the profits. By focus solely on the broken gene, the industry effectively gaslights parents into believing their child's condition was a random lightning strike of bad luck, rather than a potential interaction with the toxic world. And this system, this gene therapy system, Healthcare 4.0, is built on the backs of human suffering. And that's the heartbreaking thing of it to me, is we are handing over our organic biology to a synthetic version. And we are in a biosphere, which is also being bombarded with chemicals. And it's really not going to be a choice, but to augment. This is human augmentation is what is happening.